So we are talking about external application or external points where electricity is to be applied. We have 45 points. So we discussed about each and every point. Point number one, supraorbital nerve. Second point, infraorbital nerve. Point number three, base of nerve. And point number four, bronchial nerves, we can see here. And point number five here, solar plexus. Okay. And point number six, pit of stomach. Point number seven, gastric nerves. Okay. And point number eight, crural nerves here. Okay. At the pelvic region of lungs. You can see here lobes, where the lobes you have to apply the electricities, other remedies. And here we have the angle of jaw. Okay. And lumbar region. Okay. Point 11, lumbar region. And next we have and abdomen. And next we have the hypoglossal nerve. Okay. Umbilical region, hypoglossal nerve. Next, sciatica, arc of foot. So till here we complete and till here. Occipital, you can see point number 16, hypoglossal this region. Okay, and 17, this whole region, occipital nerves. And you can see the cervical sympathetic nerves. Okay, and we have spinal column. Okay, here we have the coccyx and sacral nerves. This is the sacrum, this is the coccyx. We will able to zoom here. Okay, these are the 20 points we studied in previous class. Today we are going to talk about another 10 to 12 points. So point number 21. Point number 21 is nerves of knee joint. So this is the knee here. You are able to see here. Okay. So this is the knee joint, okay, where we have the anterior view, posterior view. So this is the nerve which are surrounded to the knee joint. You can see the here nerves to vastus lateralis, vastus medialis, vastus intermedialis, medius. So these are the nerves supplying to the muscles, and we have the knee joint. Okay, you can see sciatica nerves, optic nerve, medial nerve, common perineal nerve. Okay, so these are the nerves. So we have to apply on this area, anterior area, mostly anterior area. Posterior area we will discuss. Okay, so anterior area is point number 21. So here what you can apply? You can apply electricity according to the polarity, and as well as second thing is that according to the you can add F2 or word 2 also according to the condition, inflammation, mostly osteoarthritis. We have knee arthritis, osteoarthritis. Okay, and the grade 1, grade 2, grade 3, grade 4. Some person need joint replacement. Okay, so these are the things, conditions where you can apply and treat the patient, and you will get the benefit, maximum benefit by applying those remedies. Okay, next we have point number 22. So here some confusion is there. Some according to the anatomy, perineum is this part, but according to the electrohomeopathy, we have the posterior part of the knee. So where should I have to apply the electricity? But according to me, that if you the patient is coming with the knee issues, knee pains, we can apply anteriorly, posteriorly, same thing. Okay, if the person is coming with perineum issues, any genital issues, any the muscular problem in the genital region, you can add as perineum. Okay, so here we have the, you can see this is the posterior part of the knee where you can apply. Here muscles are there, nerves are there, okay, arteries, veins are there, so you can apply directly here. Wow. electricities or else other remedy according to the condition. So what are the other remedies you can apply at the knee? Mostly C4, C4, F1 or F2. So mostly C4 is the best remedy for joints. So with F2, C4, WE or else I advise BE and GE for knee pain, not REYE. Okay, because we have to heal that area. So if the right side BE, left side GE, you can apply F2, C4, GE or BE for application at knee joint issues anteriorly and posteriorly. Okay, so this is the 22 point, that is perineum. Okay, 21 and 22 both for knees. Next, the 23 very very important for knee, sorry, kidney issues. Okay, like kidney stones, kidney nephritis, hydronephritis. Okay, and number of issues are there: kidney failure. Okay, diabetes issues, or kidney shrinking, atrophy of kidney. And for all these issues, you can advise point number 23 for these issues. Okay. And next we have 23. After 23, you have 24. Hypochondric region. This is the hypochondric region below the chest region. This is the right side. This is the left side. You have the mostly liver. Here we have the spleen. Okay. And lower lobe of the lungs. Below the diaphragm, we have this area. Okay, so this is applicable for fatty liver, splenomegaly, and we have the abdominal issues of hypochondriac region, pain in hypochondriac region. You can apply the electricities here. And according to fatty liver, you have that. Cirrhosis of liver, you have that. So you can use S5 also. Okay, other remedies along with it, or S3 also. Next, we have the 25 point, that is pubis region. You can see this is the pubic symphysis. Here we have the pubic region. Okay, you can apply the electricity, but it is the middle part, so you can use WE or REI. And if there is inflammation, add B. If the burning sensation, add B. There is bleeding, add B. So likewise, you have to select the remedy here. Okay, so if the bone issues, you can add C4. Okay. Okay, so this is the pubic symphysis area. Pubis 25 point. Next, you have urinary bladder. Point number 26 here. You can see that point 26. Urinary bladder. So urinary bladder, you have urinary bladder stone, unable to holding the urine, any issues, prostatitis like that problem, uh, and uh, paralysis of the urinary bladder, unable to incontinence of urine, regular bowel, unable to hold the urine. So all these issues can be treated by pointing here electricity. Again here, WREYE. Okay, you can put any remedy here. Next we have 27, a region of heart. So I already told you that you can put according to the condition, the disease. Okay, mostly BE is utilized here, so you can apply BE here. So I have my own, or in my own home, I have my grandfather. He had heart attack, and he had three vessel block. I think so, 50-60%. So, okay, so from past 6 to 8 months, he's using electromyopathy. He is very well. Okay, no further any any problem occurred. So he is applying now. Also, he is applying the according to the condition. You can advise. Okay, next we have the point number 28, that is ovaries. You can see this is the ovaries. Okay, you can advise the female patient, PCOD, infertility, menstrual issues, bleeding, vaginal bleeding, everything you can advise ovary and hormonal issues. So you can advise this application. So mostly S2, C2 are utilizing here along with G or BA. Okay, because we have to heal that. Okay, so 28. Next, we have the 29. So in the 29, we have the point number 18 that have cervical sympathetic nerves. Here, cervical spinal nerves. Okay, some sympathetic nerves are going to the heart from that area, lungs. So at that point, you have to use point number 18. But any cervical issues, spinal, only cervical column issues are there, and you have to use this point. So basically, both are same. If you try point or this or that, you can get the same result. But according to the condition, you have to understand what condition is this. Is a spinal cord problem or spinal cervical sympathetic nerve problems. Again, you have thoracic region. You can see this is the thoracic region T1 to T12 or dorsal and dorsal region. Mostly patients have TB of the dorsal region. You can advise this remedy or fracture or any damage of thoracic cavity. Anything you can advise this here to apply application. Okay, and again we have the second. We have the lumbar spinal nerves. Again, we have the in the point number 11, we have the lumbar region, whole lumbar region here, but we are specifying that spinal nerves. Okay. So here this is the spinal nerves. You can see S1, S5, L1, L5. So the complete area we have to apply the applications. Okay. Like lumbar spondylisis, prolapse intravertebral disc. These are the common back pain. These are the common conditions. Okay. Be able to see in your clinic. And point number 32, nerves of ankle joints. What are these are the nerves. You can see that mostly peroneal nerve is coming from that region. Okay, it is giving supply to the whole foot. Okay, superficial peroneal nerve. So deeper peroneal nerve. So all those branches are there. So we have to apply that area, particularly mostly here. What there is a pain, so you can apply from this area to this area. The whole area can be covered. Okay, so this is all about ankle joint. So covered 32 points till. So remaining 13 points will cover tomorrow. Okay. So if any doubts, kindly ask.